good morning, good evening from wherever you are joining us. Welcome to the Pulse of Family Planning with Dr. T. Today's theme is the future of family planning, and I'm absolutely excited and thrilled to be joined by two amazing guests to have this conversation on the future of family planning. I'm joined by FP 2030 Executive Director, Dr. Samukeliso Dube, as well as Advanced Family Planning Tanzania Director, Halima Shariff. And today's conversation is particularly important as we talk about our renewed family planning commitments and the future of FP community and advocacy. I'm just going to take a few moments to introduce you to our guests. I'm going to start with Dr. Samu. She's the Executive Director of FP 2030 with more than 20 years experience in healthcare and included several senior roles in the delivery and financing of healthcare. Dr. Dube has experience that spans across geographies, most of which has been spent delivering various models of healthcare in Africa. Dr. Samu Dube has a degree in medicine and surgery from the University of Zimbabwe, a master's in public health, a diploma in tropical and infectious diseases, and a master of business administration, as well as a master's in finance and investments. And so you can see why she's so important for us to talk about financing and resourcing of family planning as we move ahead to 2030. My next guest is Halima Shariff. Halima is a director of advanced family planning in Tanzania, where she engages in policy, budget, and media advocacy for sustained family planning funding and access to quality reproductive health care with a special focus on youth access. Halima is an accomplished Tanzanian media specialist and communication strategist with more than 30 years experience, and she has more than 2 decades of experience and knowledge in smart advocacy and public policy in sexual and reproductive health. Very exciting for me to speak to both Halima and Samu in this conversation. You can hear from their bios why they are so important for this conversation. And I'm going to move directly to my guests because I'm as anxious and excited to hear from them as you are. I'm going to start with Dr. Samu and hand over to you for your 5 minutes of opening remarks, after which I will hand over to Halima, and then we'll get on into the actual conversation and your Q&A between the three of us. Over to you, Dr. Samu.
Thank you so much, Dr. T. And how lovely it is to talk about it's the pulse. We're saying the pulse of family planning, right? What is it that we need to keep our fingers on to make sure that we deliver, at least in this decade, we deliver family planning for all. I think for me, Dr. T, there are many things that we need to be cognizant of as we are advancing family planning. The most important and where I see it is around countries, first of all, making that first attempt to saying we are committed to something that is a great investment, because studies have shown that family planning is perhaps one of the best buys around maternal health, a best buy around reproductive health, but most importantly, it's a best buy around economic development. And that's why we are keen as FP 2030 to see some of those figures around the investments that countries are making towards family planning, and going towards a more sustainable framework of funding family planning going forward. If I may, Dr. T, what we are seeing that whilst there is still donor dependency in many countries, we are seeing efforts from many corners for domestic financing to create the resilience around family planning, which we need. We need it in various spaces, as you say. Halima is experience around youth involvement. We need that resilience so that it can build gender equity in many countries where we work. We need resilience so that we can build even family planning access, even in conflict situations. I want to quote even Babatunde, the late, who says that the single most important investment that you can make for women and for economic development is family planning. And Dr. T even closer home, paying tribute to one of our fallen heroes, Dr. Edward Mhlanga, who actually spent most of his life trying to make sure that women could have access to many of these reproductive health services. So onward, and I'm looking forward to a great conversation with you and your listeners.
Thank you so much, Dr. Samu, for that introduction. And, it just sets the tone so well for us in terms of where we are, but also where we need to go in a very dynamic, world. You're just talking now about humanitarian and moments of crisis. I will hand over now to Halima for your contribution, your opening remarks, just to share with us, where you are at, what are the things that are moving you currently in the space of family planning. Over to you, Halima. Please unmute yourself, Halima.
I did.
Perfect. I hear you now.
Thank you very much, Dr. T. And it's an exciting moment for me to join Dr. Samu in this very interesting conversation. And Dr. Samu brought up some very key issues in this discussion. But as an advocate for many years and as a journalist by profession, I think first I would like to pay tribute to the global community, like state and non-state actors, which include NGOs and CSOs, for staying on course and gradually moving from a place where sexual and reproductive health and rights were a taboo subject. I think I remember 1994 when I was still a young journalist. This was almost a no-go, to the current times where they have become integral to the policy discussions and decisions on sustainable development. I think despite varying cultural and political sensitivities attached to sexual and reproductive health, with family planning at the center of this agenda, we are at a place where we all have come to terms with the fact that these issues are inextricably linked to empowering women and enhancing individual choice on issues related to fertility and childbearing. The rights language at the moment is gaining momentum. Discussions on family planning and reproductive health are incomplete without talking about choice, availability and affordability of services, rights to privacy, especially among adolescents and youth, quality, equitable access, and so forth. So I believe that family planning commitment by different countries is a testimony, it's a great indicator of acknowledging that family planning's contribution to improved maternal and child health is very important if we are pursuing our socioeconomic goals. And we cannot overemphasize this. At national level, managing fertility without being coercive is, of course, an opportunity towards harnessing demographic dividend. You, Dr. Samu, myself, and those living in Africa, we know that majority of Africans, including my own country, Tanzania, have a youthful population that is dependent and not actively contributing to their country's GDP. In our country, 63% of nearly 59 million people are under 25. So I believe that the future of family planning, the need to invest in family planning is something that governments cannot ignore. Committing to family planning is certainly a pathway to enhancing the health of the general population. I look at family planning as a pathway to a brighter future because we will be addressing, as Dr. Samu pointed out, issues around maternal and under 5 mortality. We're going to be addressing head-on issues around gender inequalities with respect to access in family planning services. We'll be unlocking economic opportunities for women and their families. And most importantly, as an advocate, I'm an older advocate, of course, but we will seriously look into the unmet need for family planning among adolescents and youth. So I'm seeing a bright future. I'm seeing a future that without investing more in family planning, we are not going to attain what we had, set ourselves as a global community. Thank you.
Thank you so much, Halima and Dr. Samu, for those opening remarks. And I'm immediately already thinking about this particular moment in time, right? COVID-19 presents us a moment of reflection, a moment to reflect on, firstly, how resilient but also agile health systems are. And secondly, reflecting on the ability of those primary healthcare services to be maintained, right, during a pandemic, during a time of war. And as an independent expert at the UN, together with my other colleagues, we've noted, up to 12 million women who may have lost access to contraception, right? And 1.4 million unintended and perhaps even unsupportable pregnancies that may have occurred during 2020. And this is across 115 low and middle income countries, right? The three of us reside in those countries. So what does it mean? And I'm going to start with you, Samu. What does it mean then when we have service disruptions, we have stockouts, we have financial hardships, right, that impacting especially adolescents, but also women when they're trying to access contraception and family planning methods, in terms of some of the difficulties perhaps that you've also noted around this moment of COVID and its impact, on sustainability and access.
Yes, thanks for that pulse, Dr. T. I think the issue you mentioned resilience, agility, and sustaining what we have gained. And COVID-19 is actually pointing clearly why we need to do that. So when we're looking at some of our data from FP 2030 around the investments that has been made, we are intently wanting to analyze the data from COVID-19 around the resources that have been sort of set aside for family planning and some of the intricate analysis that is needed in those trends that you are highlighting. Because what that does, Dr. T, is that it helps us to then build those resilient systems. Now, what COVID-19 again is pointing, us to is a direction of travel where we shouldn't be completely dependent on one system, which is the health system. Is there a dialogue that we ought to have for demedicalization of some of the entities around family planning? And I think that is needed. That is important because when you're looking at the delivery mechanism for most of the family planning commodities, there are many that could be delivered outside a health system, meaning we should also bring in newer players. We should be having conversations with people who have not been having conversations with before. You spoke again, around digitalization, getting youth involved. Isn't this an opportunity to create a future that perhaps doesn't exist? Given, the momentum that was gained since 2012, since we actually came together as a world saying we need greater access to family planning, shouldn't we actually be working together again saying, what is it that COVID-19 is teaching us about resilience? For me, it's about leapfrogging. For me, it's about deepening. And for me, it's about broadening some of those endeavors that we have tried before, especially in digital health. And we always talk about task sharing, where we need to broaden the scope of practice for some of the community health workers and even getting access to these family planning commodities. I want to also talk about the issue of unintended pregnancies. And we're sitting here in South Africa where I have used the term almost an epidemic of teenage pregnancies. And this again is because of lack of access, barring the socio-cultural norm. Some of it is just systemic issues that we now have to analyze and make sure we can program around and against so that people can have access to family planning even in areas of conflict. Meaning our method mix needs to be as agile as our thinking around those systems that we want to create, and moving from health systems approach to a community systems approach and building resilience using other commodities or other methods. For example, the group, and again, Halima, you're close to this more than me, even in the high impact practices. What is it that is going to be high impact in a conflict zone or for teenagers, given COVID-19, given conflict situations? And we need to just program better. We need to program with people who have not programmed with before. I wish, Dr. T, that at the ICFP, at the conference in November, we have conversations with ministers of finance. We have conversations with ministers of economic development, around the investments that are needed for us to bridge that gap. Because if you're losing like opportunity by having unintended pregnancies for 1.4 million people globally, that for me is a missed opportunity for us to program better. So we need to bring in around the table those who have not been talking to before. So again, the future is bright for us to be able to do things cheaper, better, faster, but leapfrog to that future.
That's incredible. And I like the fact that we need to talk to people whom we don't necessarily immediately associate with the community of family planning, right? Such as the ministries of health. And yet they determine so much of the national budget. They determine where the health budget, right? And what are the priorities that they will be spending? Because often I say, you know, when I speak even with other colleagues, it's one thing to look at what the country budget is for health, but it's another, right, to be granular in the detail of which programs in health that affect women and girls, especially family planning, are funded. Do they have access to a wide option of modern contraception, right? But also importantly, does the spending actually happen? Because you have budgets, but sometimes you don't necessarily actually have spending in those priority areas. So I think it's a very crucial point that you are bringing here, Dr. Samu. And I think it's about also accountability, which leads me to you, Halima. I mean, you work in the community, you're very close and connected, right, to what advocacy solutions can and should look like. And when I think of your work, I think of equitable and effective family planning. And can you tell us from, you know, your vantage point, perhaps even reflect on what COVID how it has impacted your work, but what does women and youth-centered policies and programs and services look like, right? How do we assist meaningfully young people who need, right, socioeconomic development that's sustainable? And we know that can only happen when we have programs and services around family planning. So where you are working currently, what is the situation on the ground, and how have you managed to turn some of the difficulties into equitable solutions?
Thank you so much, Dr. T. The situation on the ground as far as Tanzania is concerned, and I think learning from other advanced family planning countries, we may not be very different from each other. The situation is on the ground is that we still have a big challenge of getting commodities to the last mile. We still have a challenge of circumventing or transcending these social norms that do not address the reproductive health needs of young people, especially adolescent girls. So we are in a situation where there is hope for the future, there is progress, but then there's a lot of work, a lot of advocacy work that needs to be done to ensure that the majority of the population have access without any stigma and discrimination. The policies are enabling so that, you know, wherever they go for, they can afford these services. So the situation on the ground is giving me as an advocate a lot of hope. For instance, in our country right now, the contraceptive prevalence rate has risen. The commodity situation, commodity security situation is great, but areas that really need a lot of investment, and I think has kind of received a blind eye, are the areas around demand creation, which also falls under social norms, and the areas around adolescent and youth. So there's a lot of advocacy that is needed across the government level, the national level and the subnational level, to ensure that first, these programs are, you know, are not only managed, but are financed through our own resources. Because sometimes when programs are financed by donors, there's a tendency also of leaving that piece for the donors and, you know, lagging behind in terms of increasing or investing in family planning services. So, and then also, there's also an issue around the policies that, for instance, in the East African countries, Tanzania is known for very favorable policies around adolescent, but again, we are not moving in terms of getting the services to the adolescent and youth. The teenage pregnancy issue that Dr. Samu brought out, that is a very big issue in our country. There's some action that is going on. A lot of advocacy is needed, yet we have, as a community of practice, the family planning partners, we have to bring in as many as possible CSOs that are run by young people, that are managed by young people, and that already have a voice. And that is a trend that is picking up. And I'm so excited that FP 2030 has a structure that actually demands that we have a youth focal person. That has really contributed in getting this agenda around adolescent and youth to move forward. However, there's a challenge around holding leadership accountable, especially when you bring the issue around rights. That language is still a bit tricky. When it is discussed by young people themselves, I think it gains traction as opposed to NGOs and people who of my age and under. So we are, as a project and other implementing partners, are seriously giving that space and bringing in young people into this conversation, because I think in this area they know best.
Absolutely, Halima. And you know the point you're making about rights. It's an issue that a lot of young people are still grappling with. You find that even in countries where there's successful programs, there is still that hesitancy, right, to actually engage around human rights frameworks that will ensure equitable access to care. And a lot of advocacy for young people, especially the community of ICFP and more broadly, a lot of it is around advocacy and accountability. And we know that under international human rights law, states must ensure sexual and reproductive health services, which includes modern forms of contraception, as well as information, which a lot of people are still struggling with, as well as education on family planning. And interesting, during the launch of the Sustainable Development Goals, 193 member states of the UN adopted the Universal Access Goal, which will be, and it's supposed to be the main catalyzer, right, to what they call ending global poverty, building a life of dignity for all, and leaving no one behind. And yet I'm left wondering, you know, Halima, after your intervention, how much really is the commitment to these goals and to really ensuring dignity for all? Because ultimately that's what it's about. You know, we know that the ability to make choices and decisions about if one wants to get pregnant, when you want to get pregnant, and the outcomes of that pregnancy are human rights. You know, we're talking about rights to autonomy here. And it's interesting for me, again, that the human rights element and that discussion is always met with a little bit of coldness. And I wonder why that is. I mean, Dr. Samu, in your work, you know, as people who are thought leaders, financing programs, how do you see this issue of human rights being important as an approach to get to equity, especially where, and you can tell us with FP 2030, some of the areas geographically that you work in, because they are very different. I'm sure the legal framework across different regions is very different. So how do you see equitable care and how do you see human rights playing a role?
Yeah, fantastic question there, because you are bringing together the issue of equity and the issue of rights, you know, in the same vein, Tlaleng. I think for me, so one of the things that FP 2030 is already doing, we are regionalizing. So we are going to be having regional hubs, 2 in Africa, 1 in Latin America and the Caribbean, and another in Asia and the Pacific, in addition to the one that we already have in North America and Europe. That is a move that should get us at least closer to where the real issues are. You can't grapple with everything that you want to grapple with when you are in a centralized format. So we're trying to decentralize a bit so that we are closer to understanding what those rights issues are, what those financing issues are that may affect equity. The issue of rights on its own, I mean, when you're talking about family planning and when you're talking about women, you cannot divorce the issue of rights. And so people talk about rights-based family planning. I don't know, Dr. T, whether it can be in any other way. You know, family planning should be rights-based from the word go, because this is about bodily autonomy. This is about choice. This is about agency. And family planning is not an end in itself. We know family planning around sexual pleasure, but for me, here sitting as a woman in Africa, I want to deliver in 2030 family planning, not just increasing the number of users, but I want family planning to mean something for economic development, because we are saying we want to participate in economy. We want to be active participants, women and girls. We don't want to be hindered in our track to make sure they're active economy. So it's a right, because that on its own ensures that, you know, there is access to more. So when you're touching the issue of equity, then we talk about what, you know, even the universal health coverage agendas, the signing on when we started the SDGs, people saying, you know, we ought to make healthcare universally accessible. By the way, family planning is a foundation for good healthcare everywhere you go. You cannot have primary healthcare or even that minimum package of healthcare without including family planning. So it's important that we get that going. But you could also expand that package, right, by saying if I invest here, then I invest in those other adjacencies that then propel that package to be investable, if I may. The challenge has been, Dr. T, and I don't have an answer for that, why in Africa we still don't own some of that, you know, the accountability, even though we do advocacy. Why is it that we still can't fund that? I think for me, the short answer that I have in my mind is that we are talking to just implementers. We should talk to those who have got the money and the test, and we should try and increase the sizes of GDP so that we can invest more in the things that matter and would ultimately lead even to growth, GDP growth that would ultimately, Halima, as you say, lead to better yields in the demographic dividend. So it's actually a bi-directional equation around family planning, investment, and the equity story in the health and wealth agenda as you and I know it.
And I remember a few years ago attending a conference in New York, and the theme was around the demographic dividend, right? And feeling so frustrated that the people in the room weren't talking about the youth, and I was much younger then. So they were talking about us, right? And the investments they were making in the youth so that we can be healthy to contribute to the capitalism and the growth of economies. But there was that missing element of investing in youth and young people because it's the right thing to do, because they have a human right to live well and healthy, both physically and mentally, you know. And Halima, from you, I mean, you do an amazing program, right? The smart advocacy approach. Please tell us a little bit how this has worked, right? Because you connecting the short-term advocacy strategies and wins, and I think merging very well with what Dr. Samu is talking about the long-term goals to 2030, because we know that the needs are immediate, right? The contraceptive and the family planning needs are immediate and right now. So how do we provide care and services right now while we know that there's a future that we are also working towards, right? Hence the theme of today's discussion, the future of FP. And I think, Halima, you very much about the now and the advocacy for now. How does that look like, and what are some of the wins that you can share with us that I suppose Dr. Samu and her team and colleagues can build on, right, to get to that FP 2030 future that we are discussing?
Thank you very much, Dr. T. First of all, I'm glad you brought up the smart advocacy approach. I think our approach is looking at advocacy wins, building on them within 6 months to a year, 18 months is tops, because we believe as you don't need to have a big, you need to have a smart objective that will enable you to kind of pull together the little wins that you get, because at the end of the day, these wins matter. And advocacy, smart advocacy or any advocacy, is based on evidence. So what we normally do is to just look at what the evidence is telling us, where the barriers are. For instance, right now, I will talk a little bit about the wins much later. For instance, right now, we know our CIP, or the Costed Implementation Plan, has been, there's been an assessment, and we are seeing that there's very little investment going into social norms, the demand creation piece. There's very little investment going into adolescent and youth. You see, we're doing good in contraceptive security, and then we're doing good in some other area. But those two areas, that's the evidence. And we know the main problem here is that the SBC, or the social behavior change communication programs, are very much donor dependent, just like the way family planning is. So local government authorities, the national government, there's very little investment going into addressing social norms. So that kind of evidence is something that we pick up, and this and through our approach is to really look at who is the key decision maker to make that happen. So we don't go with placards or and I'm not undermining that approach, but we are following up on who is going to make that decision. How can we get to that decision maker? What will make that decision maker tick? What will resonate with that decision maker? So that has been our approach, and we've had a number of wins in terms of improving the policy environment here in Tanzania. We have wins over the past 10 years in terms of increasing allocations in family planning, domestic resource allocation, which is great. However, we're struggling with the disbursement. We're struggling with issues around transparency and so forth. So it's an approach that looks at small wins to build to the bigger outcomes, you see? But I wanted to kind of talk a little bit about what Dr. Samu talked about. I think as an advocate, I feel each country has its own context. The issues around rights is an issue that each country will have to grapple with in a manner that they will still continue to be relevant at within the global community. So I would just like to appeal that some rights may be difficult to push in some context, and we as advocates have to live with that, because otherwise we will lose more by pushing on certain rights that our government at the moment it does not want to address them. And I want to be optimistic that since we began many years back, as I said in my statement, we are making headway towards the language of rights. We are now, for instance, Tanzania, we have a commitment around women rights movement being part and parcel of implementing the FP 2030 commitment. There has been a realization that women rights movement in Tanzania is doing very well when it comes to gender-based violence, women in leadership, women in employment. What about the sexual and reproductive health rights and issues around fertility? What are they doing about it? Maybe there isn't that understanding within this group, but again, now they are on board. They are taking that on board. And for me, I feel very excited about it. They are owning that agenda. Now, issues around rights and sexuality and sexual education, they have some connotation and they're quite sensitive. I'm sure you all come from African countries. So we may be here advocating for those rights, but then we also have to be satisfied whatever step we make ahead and live with it, and then regroup and move to achieve something else. We cannot push the rights agenda all in its totality. Otherwise, we are certainly going to hit the wall. I've said a lot, but I'm just feeling like we just have to work within our context, maneuver within our context, but stay focused on what we would like to attain without undermining the rights of girls and women in accessing contraceptives and any reproductive health services. Thank you.
That is so important, and thank you for that. I think the issue of particular contexts, and you are right, Halima, that they are different, but also they are dynamic, right? And they are ever changing. So the context itself is very different from a year ago, 2 years ago. And that's why it's so important to have continuous, meaningful participation of people on whose behalf we say we are doing this work, right? They need to be at the decision-making table. And I think at every level of healthcare, whether it's in clinical care, whether it's in health systems, whether it's in legislation, we do need more participation. And I think this will aid in that transparency that you were speaking about, because a lot of the times you can't advocate, right, if you don't have the information of what is happening. You can't advocate and hold, elected leadership and governments accountable on their own commitments, by the way, that they are making not only nationally but internationally. And I know all of us, I know very well, and right now, in terms of, people who are internally displaced, refugees, people living in humanitarian settings, and that they are even further marginalized, right, because of those contexts of war and displacement. And it is often adolescents, it is often women, who are already living in the margins, but those situations make access to services virtually impossible. Which leads me to the next question for you, Dr. Samu, about partnerships. How important is it for FP 2030 to engage again with communities, with stakeholders, right, as we try accelerate our actions to try and meet these 2030 targets? How is it important, and what are some of the strategies that we can look forward to, especially for you in your new role as executive director, about this meaningful participation, about building partnerships across the different landscapes, across the different legislative frameworks, and definitely the different contexts that particularly young people find themselves living in every single day?
I must say, Dr. T, we are already standing in the shoulders of giants, right? The work, we have been given a runway within FP 2030. We are a support network, meaning we are a partnership-based. Ours is a partnership-based model. The question that I'm asking ourselves is, are we talking to each other? Do we need to broaden our partnerships? Certainly, we need more people who have got the pets, right? That is, non-traditional donors of family planning need to come on board. We need to get private sector on board. We need to get more governments that, remember, in our previous establishment, when we had FP 2020, it was 69 countries. Now we are actually opening it up to more countries globally. And some of the countries, actually, the commitment would be about what they bring to the table over and above to what they they themselves are committing to family planning in their own countries. So we are broadening that partnership structure, and we are also over and above, I spoke about regionalization agenda. In there, Dr. T and Halima, there is the youth engagement strategy, where we are saying youth partnership, not just engaging youth. Partner with them on the ground, meaningful partnerships on the ground. That modus operandi my team have been working on for years and want to deploy that capability in the countries where we work. And the other issue is about gender. Some of those social norms that we've not been tackling well, we want to make sure we engage with those stakeholders in that space of social norms, again, Dr. T. And more importantly, I think for me, is to make sure that the stories of women on the ground, understanding the perspectives of end users for family planning, that is important. Do we know what women want, or do we actually push products, technologies, methods that we think work? Do we know ground up, a grassroots, grass-tops approach to programming is important? And to your point again, Halima, the venue shifting agenda. If the government is saying they don't want to listen to this language, we know as advocates what the right language is to bring to the table. We need to venue shift. So again, smart advocacy is going to be our modus operandi. So I'm saying I'm standing in the shoulders of giants, because advanced family planning, they've laid well some of these tools, but I want us to broaden the conversation to outside this family planning agenda. Thank you. Thank you.
Thank you so much. And I want Halima to just have your closing remarks in a way, just to wrap up for us what the future holds for you in Tanzania. I think you have a particular interesting context there. And what are some of the, advocacy opportunities that you see that you can embark on, and especially, pulling together the strength, the leadership, the expertise, and the commitment of the family planning community. We are moving ahead, of course, with the ICFP 2022 conference in Thailand. So that again is another moment, I think, of advocacy where young people can meet. What can you say to them? How can we support them, right, in this quest to also get universal health coverage that is inclusive and it expresses intention around family planning coverage in communities?
I think for Tanzania, I feel like the future is bright, and I think it's also bright. Partly, this is attributable to the country's participation in the FP 2030 partnership, Dr. Samu. I think that partnership has brought hope. It had brought committed actions, all that mutual learnings. So I feel Tanzania is well on its way in terms of beginning to implement the FP 2030 commitments, and I would say it has learned a lot through this partnership, and it's a stronger country when it comes to that. We may have some challenges in sometimes in the political leadership, but all in all, we've kept family planning in focus. So let me pay tribute to Dr. Samu. FP 2030 partnership for us is a powerhouse that I feel will continue to catalyze national processes that we have embarked on. And the other piece that I would like to say is that we, at this point, have, through the project and through the partnership that we've built, have embraced the smart advocacy, and we believe advocacy in Tanzania is there to stay, and it's going to be even stronger. When we look at even the assessment, we're seeing more partners are really investing in advocacy, because that's where we unlock the policies that are undermining or are creating barriers to access, and that's where we get our government to invest more in family planning instead of just waiting for donor funding. So what kind of a message would I have for the ICFP conference that is coming up? I think it's the time for young people to hold the torch. I just feel Thailand or the ICFP is an opportunity to look back and say that we have enough young people who are committed, who have the skills and the knowledge, who can actually take up the leadership in driving the FP agenda forward. So I'm feeling there is hope in the generation of young people. And as far as our governments are concerned, I would repeat what Dr. Samu said. We need to look at sustainable funding for family planning. I think it's high time for our countries to try and be self-sufficient, in terms of funding some of these programs, especially around improving access to family planning. I think I believe we've run out of time, but I would like to finally say the FP 2030 partnership has been a big catalyst in whatever gains, and I'll speak on behalf of Tanzania, whatever gains we have attained thus far. So keep up the work, Dr. Samu. We are behind you.
This is amazing. And I like it when the community comes together in these moments that we can really capture, the essence of what family planning, equitable access looks like. And I think for many, many people around the world, the Pulse with Dr. T has been that thread that has kept all of us connected, through this very difficult time of COVID. And we look forward to, of course, seeing everyone in Thailand in November at the ICFP 2020 conference. And I would like to thank you both, Dr. Samukeliso Dube and Halima Shariff, for really indulging us and giving us your time to share your very important insights. And it's clear for me, and I hope it's been clear for you as you watched and listened to our guests, that it's undeniable that human rights must be the center of all solutions, and that states must respect and protect key principles of non-discrimination, equality, and privacy, as well as bodily integrity, autonomy and dignity, and well-being of individuals, especially in relation to sexual and reproductive health rights. And while contraceptive use varies across regions, women living in low and middle income countries still face a greater obstacle in meeting their contraceptive needs. And this is full of barriers for women across regions with multiple and intersecting forms of discrimination, such as immigrants, women with disabilities, low income women who cannot afford private care, as well as lesbian women and sex workers. And I think the important work of FP 2030 is to show us that these populations have consistently been underserved. And so the partnership commitments to prioritizing them in all future work is important. We need accurate and disaggregated data collection and use in order to advocate. And I think with what Halima has said to us today, it's important to have country-led partnerships that can drive these commitments, that can demand accountability and transparency, both from national as well as regional and global stakeholders for the implementation and coordination of family planning services. And I can't close without having a talk about universal health coverage. It's important, and it's an ideal where people have access to health services that they need, when they need them, and where they need them, without the financial hardship. And yet we know across the world that financial protection for universal health coverage, and especially family planning, is not showing a positive trend. And I hope with this discussion today with Pulse with Dr. T, the future of family planning, you can see how innovation, collaboration will help us accelerate and meet the goals that we need. And my plea all the time is that young people must have meaningful participation. They are leaders in their own right. They are the main catalyzers to ending global poverty, building a life full of dignity for all, and leaving no one behind. And with that, I would like to thank you very much for joining the Pulse with Dr. T. Thank you, Samu, and thank you so much, Halima, for joining us. And thank you to everyone. Goodbye.
Thank you. Bye-bye.